Hello everyone. Good evening all of you. Can you hear me?
Yes.
I hope everyone is able to
Yeah.
hear me. Thanks for confirmation.
Yeah.
Okay, so today we are going to talk about inpatient coding. Okay, so today's webinar is all about inpatient coding. And can I know any one of you is from coding background? Anyone has already worked on coding?
Yes, myself, Cigma student. I'm fresher, CPC fresher, sir.
Okay, good, great. Rubna, right? Soumya?
Yes, sir.
Okay, Soumya. Great. Okay, so yeah, so there is another right. So first we will see what is medical coding, and we will see like what are the scopes or what are the things that you have to learn in inpatient coding, and we are also going to see like how this inpatient coding is going to be a fruitful career in terms of medical coding. So first of all, I would like to welcome you all to the inpatient coding webinar organized by our Cigma Medical Coding Academy. So now we have a three-center reach from Kochi, Calicut, and Coimbatore Center. So for this webinar, I welcome you all to this webinar on behalf of Cigma Medical Coding Academy. So I'm Mohammed Riaz. I'm a senior trainer at Cigma Medical Coding Academy. So I have almost close to 20 years of experience in US healthcare. And yeah, so today I'm going to talk you or walk you through what is inpatient. So what are the main objectives of today's session? So we will see what is inpatient coding and how it is different from outpatient coding. So basically we have two different types of coding. Maybe the ones who have certified or who are already having experience in medical coding will know there are two different types of coding. One is inpatient and the other one is outpatient coding. And what is inpatient coding and what and all you need to become an inpatient coder. Okay, and yeah, we are going to also walk you through the demand, the ongoing or the overwhelming demand for the outpatient and inpatient coders. And so among them, why this inpatient coding is having a global demand. Okay. And I'll also walk you through how to prepare for this inpatient coding examination, so which is called CCS, and the organize is actually provided by an organization called AHIM. So I hope many of you will now know what is medical coding. So I'll just tell you what is medical coding. Medical coding is the process in which you have healthcare related services, procedures, okay, and diagnosis are converted into numeric and alphanumeric codes. Yes, and so in which you have different types of codings, like we have outpatient coding and inpatient coding. So many of you have already got the CPC certification. You might know what is an outpatient coding. And yeah, we are going to see what is outpatient coding and the difference between the outpatient coding and inpatient coding in today's session. And we are going to also see, okay, so what is needed for us to report the inpatient coding system. So what is the purpose of inpatient coding system? And what is the qualification that you require to become an inpatient coder? Yes, so what is coding? Right, we have already seen. Okay, so it's a process of transformation of healthcare encounters into diagnostic and procedural coding. Okay, and we have two different major right coding classifications. Okay, so you might know in healthcare you will have like two different types of uh, healthcare encounters. One that happens in the hospital, okay, and the other one that happens in the clinic. The clinical ones are called outpatient coding, whereas the ones that happen in the hospital is right inpatient. Okay, when it comes to inpatient coding, you have a lot of other aspects, like you have a facility, you have a lot of doctors, specialty doctors. Okay, you have overhead expenses. You have you know in hospitals you have from housekeeping staffs to the dean. Okay, you need to pay them differently. Okay, so that is why inpatient coding is entirely different from outpatient coding. So outpatient coding is very simple in format and structure. Okay, and outpatient coding systems and reporting, everything will be very simple. On a day-to-day basis, we will report the services for outpatient coding. If you see inpatient coding or hospital coding, okay, the patients will get it admitted for number of days. Maybe for example, the patient got admitted on September 1st, on discharged on September 10th. The entire 10 days is actually right considered for the payment, or the bill for the entire 10 days will be calculated based on this coding system. So that is the inpatient coding, uh, a preface, or just an idea about inpatient coding. So in inpatient coding, so what are now you require for us to consider inpatient coding? So there are coding systems. Like for outpatient coding, we have three different coding systems, namely CPT, ICD-10-CM, and HCPCS, or we call this as HCPCS. Three different coding systems. Okay, so we use CPT and HCPCS for procedurals, and for diagnosis, or why we are doing this procedure, we are reporting the ICD-10-CM. Similarly, in outpatient, we saw three different coding systems. In case of inpatient or hospital coding, we have three different types of coding system. Actually, okay, the ICD-10 for diagnosis coding is the same. We are not having any different diagnosis coding. So be it right inpatient coding or outpatient coding, the diagnostic coding manual is the same. For the procedural coding system, we have a unique right coding system for inpatient. Right, so that is the ICD-10 PCS, which stands for procedural coding system. Right, from ICD-10, it is directly derived from the ICD-10. So that is why it is called as the ICD-10 procedural coding system. You know, right, what is ICD-10? The ICD stands for International Classification of Diseases, 10th revision, clinical modification. So that is the diagnostic coding system. Okay, we use like in medical coding. And so the same from ICD-10, you have the derived procedural coding system, which is called ICD-10 PCS. So in case of hospitals, how they are going to pay. Okay, so why we are reporting differently? So I told you already, you have a lot of right overhead expenses like facility cost, rentals, okay, and then you have from housekeeping to right professionals. So for everything, we need some right payment when it comes to hospital. And you might know, right, in India also, right, if you go and see a physician, right, in his clinic, you'll be charged like 500 to 1,000 rupees, right, per service. Whereas if you go and see the same physician in a hospital, you will be charged higher. Okay, from 2,000 to 5,000, it may go high. Am I right? That is what we see in Indian hospitals also, right? So if you see the patient, right, outpatient clinic, you will have like a very less amount of right fee. Whereas if you go into the hospital setting, okay, you will have like a package, okay, from day one till your discharge. So what and all right being offered, or what and all services that you get from the hospital, that will be billed to you as a package. So that is why right, the inpatient coding system is entirely different, and it works on diagnosis coding and procedural coding system. But the package, as a package, if you see, so the package will be paid based on right one classification, or method of reimbursement, we call this. So this is called the DRG, diagnosis related group. Okay, so in case of CPT, when outpatient coding comes, so in case of CPT, you will get procedure to procedure payment. For example, if you have a chest X-ray, you might get $200 for the chest X-ray, and if you have an evaluation management along with that, maybe another $300 for that. And if you have an injection, maybe $100 for that. So each CPT will carry the cost when it comes to outpatient coding. When it comes to inpatient coding, okay, the cost will be calculated not based on the procedure, not based on the diagnosis. Okay, so how the cost is going to be calculated? The cost is going to be calculated based on this right classification or payment system, which is called the DRG. So how this DRG works? Okay, so the DRG works on the assigned diagnosis and also the assigned procedures. So it calculates whichever is higher. So if the diagnosis is higher, so it will calculate the diagnosis based DRG. If the procedure is higher, so it will calculate the procedure based DRG. Okay, so that is how the DRG system works in case of inpatient coding. So I told you about the outpatient and inpatient coding difference. Okay, so outpatient coding focuses mainly on physician services. Okay, usually the procedures like I told you, in case of CPT, we code X-rays, evaluation management, and injection, that kind of procedures. And HCPCS, like for injection, if you have bought some vials of injectate or the drug, for the drug we will use the HCPCS. So each one of the item we will have payment independently. Okay, so that's paid differently. For the drug, you have the different payment. So for each code, you will have the payment in case of outpatient code. Okay, so this is the payment related codes, or service to service, right? You will have the payment here in case of outpatient coding. And so ICD-10 actually tells the medical necessity why this procedure was done, for which condition they are doing this procedure. So that is the ICD-10 CM. So what is the procedure and why it was done? So that is very simple. Okay, and it goes for encounter to encounter, or it is calculated for the date of service. So for one date of service. Okay, like in our scenario, we saw like from September 1st to 10th in case of inpatient coding. But outpatient means September 1st, you will have one payment, right? September 2nd, you will have one payment based on the CPTs and HCPCS. So that is the difference, right, between outpatient and inpatient coding. Okay, so here you will have the cost calculated procedure to procedure. Okay, so that is very simple, and outpatient coding systems are also very, very simple. So the cost is calculated based on the CPT and HCPCS codes that we assign. Whereas inpatient coding system, so I told you the difference between the inpatient and outpatient coding. So it covers the entire hospital stay. We call this as an LOS, length of stay. From September 1st to 10, you'll have 10 days of hospital stay. So you'll have multiple diagnoses, multiple procedures done, right? You might have some complications suddenly, and suddenly the emergency procedures would have carried out, right? And based on the severity of the illness, maybe a higher treatment protocol is followed. Okay, so all these things we have to take into consideration when it comes to inpatient code. And apart from that, you have a right, bunch of sequencing rules when it comes to inpatient coding also. Like I told you, right, whether you need to consider the procedural pathway, whether it's an emergency procedure, you will consider the procedural pathway, or if it is a like condition that is worsening, okay, we'll consider the right diagnostic pathway. So all these things, right, will be calculated, or will take a role in selecting the payment or determining the payment for inpatient coding system. So like I said, the inpatient coding system, okay, right. So outpatient coding, you do it for 1 day. Okay, the inpatient coding system, right, does it for the length of stay, for the 10 entire days that the patient was admitted to the hospital in our scenario. So it will have a direct impact on the hospital revenue. Okay, so it is actually DRG based. So we need to be very, very careful in assigning this DRG. So the particular DRG will calculate how much the hospitals will get for the 10 days of stay. The entire hospital day, so the entire diagnosis procedures, right, any complications, okay, so everything, right, is actually calculated based on just one 3-character code, which is called the DRG. So everything, okay, is calculated, right, by using this one DRG that we are assigning. Okay, so the one DRG, right, based on which the hospital revenue is actually determined. Okay, and so not only that, you have to always be compliant with the organizations that we have in the US healthcare, right? So we call them as CMS, the Center for Medicare and Medicaid Services, OIG, Office of Inspector General, and international paying standards. Okay, the payers or insurance companies, right, standards. So everything we have to meet, right, their expectation, and we have to code according to that. And it also supports quality reporting. Okay, the physician also takes a faithful effort to document the conditions, right, document the procedures, document the diagnosis in the medical record. Okay, and yeah, so the based on the severity, okay, the risk and patient outcomes. So the quality, based on the quality, right, we are going to assign the quality of the medical record or documentation. We are going to assign our DRGs, right? So the documentation also is playing a very important role in case of inpatient coding. What skills you will require? So for in case of skills, like for medical coding, you might require the coding knowledge of ICD-10-CM for diagnosis, ICD-10 PCS, the procedures, and based on these two, how we are going to calculate the DRG grouping system. Okay, so we need to have a good knowledge in ICD-10 codes and the guidelines, sequencing rules, ICD-10 PCS coding. So you have an entirely different coding system for inpatient. So you need to have a good knowledge or expert knowledge in ICD-10 PCS. And you also need to know how these two, the diagnosis or the procedures, is going to have an impact on our DRG, the diagnostic related grouping. Okay, so the hospital systems are actually paid based on this diagnosis related grouping. I'll tell you in any scenario. Okay, for example, the patient is coming in with COVID-19, and you also have a comorbidity of the patient having diabetes or stroke, any other comorbidities the patient is having. So when the patient is having any comorbidity, right, how this COVID-19 will be treated? Okay, the hospital recognizes that comorbid conditions, right, and plans the treatment protocol, right, based on the comorbid condition. And sometimes you have a patient with COVID-19, but you don't have any comorbid conditions, or there is no risk for no risk from other conditions for this COVID-19. So in that scenario, the treatment protocol, right, will be different. Okay, and yeah, you have a suspected patient, having all the symptoms of COVID-19, suspected patient. Okay, so now the patient comes in and gets admitted to the hospital, right, saying that yes, what is the problem for the condition, I mean for the patient, so they have to diagnose it. But before even the diagnosis, they will start the treatment protocol and try to control the patient's COVID-19 symptoms. Okay, so even if the patient is not having COVID-19 or the patient is having COVID-19, okay, the treatment protocol will be already started. So that is why the hospital payment system is calculated based on the DRG grouping, which is also referred to as the diagnosis related grouping. And I see someone asking questions from the chat box. Okay, we are coming to that. Next slide, we will see what are the requirements. Okay, so yeah, so technically you need to be having a sound knowledge in ICD-10-CM, procedure coding system, ICD-10 PCS, and you need to also have a good understanding of the DRG grouping, the diagnostic related grouping. Okay, and yeah, so this will be entered, the diagnosis and procedure codes will be entered in an entirely different claim form for inpatient coding system, which is referred to as UB04. Okay, so when it comes to outpatient coding, okay, you have a very simpler claim form where you can report the diagnosis and procedures. Okay, that is called CMS 1500. So when it comes to hospital, you have UB0 form. This is a claim form unique for inpatient coding. And we need to analyze the inpatient records. It will be different from the outpatient record. So outpatient record, you will have only one date of service, only one record. Okay, maximum. Right, when it comes to inpatient coding, so you might have the patient being admitted to 10 days. So on the 10 days, whoever the patient has seen, maybe in the beginning, the patient would have been seen by the admitting physician, later some consulting physician. Okay, so likewise, you will have for the 10 days, you will have the record or medical document. So we have to review all the documents, see what are the diagnoses. Maybe sometimes a condition will be evolution of the condition. You can see from mild stage to severe stage, or sometimes you will see the improvement of the condition from severe stage to mild stage. Okay, so all these things we have to review from the medical record. Okay, and yeah, from day wise we will go like day 1 to day 10 and review the discharge summary. Finally, what the physician is documenting. So all these documentation, okay, we have to review and assign the codes based on that. Okay, and we need to also have a good knowledge, seeing the gaps in documentation, identifying the missing information in the documentation. So when there is any missing information, we need to query the physician regarding the missing information. So we need to complete the code with that particular information which is missing in the medical record. So we'll ask the physician, can you please clarify whether this COVID-19 was diagnosed or any blood test was done for COVID-19 and the patient blood test was positive or not. So like that we can clarify. So if the patient is admitted for COVID-19 and you don't have the definitive diagnosis of COVID-19, not yet established, okay, by a medical record or like a blood test or a standard documentation from the physician is not there. So we'll query the physician for clarifying the documentation, and this is called the physician query process. This is also very important, and this kind of standardize the medical documentation. And when anyone audits, okay, this codes, so they will find that the information is available, and we have assigned the codes based on the information available in the medical record. Okay, so that's called the physician query process. Okay, so other than that, what you will be learning in this inpatient coding is CMS policies, OAG policies and their guidelines, and how to meet the expectations from these two organizations when it comes to inpatient coding. And we have some edits also. Okay, the NCCI edits we have so based on what type of information we have. So we have to follow the edits also. So here we have MCE edits and MCC, like NCCA, you have another edits called MCE edits. So we will see both and code according to the edits. And then we need to also be compliant with the HIPAA and data protection rules So because we are handling the sensitive information of the patient's health. So right, all these knowledge we'll require for the right inpatient coding. So I'll simplify or simply tell you, right, for us, the first thing for a medical coder is to understand the documentation. The documentation, right, a review. So identifying any gaps, okay, for documentation. The documentation review is first thing. So based on the documentation, we will assign diagnosis and procedure. And based on the diagnosis and procedure, we will find a DRG. Okay, and the DRG will talk about the weightage of the hospital stay. So whether this diagnosis is putting a higher weightage or the procedure is right putting the higher weightage. So based on that, we will right take the final weightage and right we will uh, try to get the maximum weight DRG for the hospital encounter, and right we will reimburse based on the DRG. So DRG will actually provide the weightage. Okay, so based on the DRG only, the hospital payments will be calculated. Okay, so I'll give you one example. So if the hospital base rate is $1,000, okay, and based on ICD-10 and PCS, you are getting a DRG of right 5. Okay, so the total payment will be 5 into 1,000. Okay, so that will be $5,000. So this is how the right DRG weighs actually the hospital encounters or hospital stays, okay, and gets the payment right based on its weightage. So that is called relative weight. So each DRG a 3-character code. So DRG is also 3 letters, and the code is also 3 characters. Each DRG will be having a weightage. That is called relative weight. So that into the base rate. So will be the total final fee payment right in the hospital setting. Okay, so that is why we are calculating the DRG. Yeah, so these are the technical skills that we require right for inpatient coding, and the soft skills like for all the job. Okay, we need to have an attention to detail, analytical and critical thinking, communication. So the physician querying processes, right? All these require us to write a mail to the physician. So the communication, mail etiquettes, okay, and communicating with the audit teams regarding any errors. So all these things we need. So and additionally the analytical and critical thinking. So I would like to emphasize on this point because you have to review all the right dates of services, like all the 10 days of stay, and think right take the critical and critical information into account, like the procedures or the diagnosis, think analytically, and finalize your DRG. So the analytical critical thinking is a key aspect of DRG calculation. So next comes to the certification part. So what certifications are required for us to consider a DRG or on inpatient coding related career? So if you are choosing this career in inpatient coding, minimum what certifications are all accepted or currently available in right the market. So these are the certifications, as you can see, the CCA, CCS, both are actually provided by AHIMA. I mean, AHIMA is the right American Health Information Management right, Association. So they provide these two certifications, which is CCA and CCS, Certified Coding Associate and Certified Coding Specialist. And when it comes to AAPC, you have the other two certifications, CIC and CPMA. CIC is Certified Inpatient Coder, and CPMA refers to Certified Professional Medical Auditor. So these people will have a good knowledge in ICD-10 coding systems like ICD-10 CM, PCS, and CPT and HICPICS, everything put together. So they will have a good knowledge, right? And they will be able to calculate the DRG. And yeah, we need to have a good hands-on experience with right inpatient DRG calculation. Okay, so practical training is needed. So that is why I told you about the hands-on experience. So using the various softwares like 3M, okay, and DRG, open softwares. So all these we need to have a good hands-on experience. So how this diagnosis and procedures will have an impact on your DRG. So all these things we have to make sure that we are understanding right when it comes to DRG. So practical training is very important. So we need to have a good knowledge in the coding systems, plus we need to apply that right using practical training. So we will have some chart studies. Okay, so how to determine the ICD-10 PCS, and finally how we will calculate the DRG based on practical training, case studies, and we'll also do some mock audits on how you are coding these case studies, and we will provide you with the feedback for each and every case study. So whether you have went in right put the correct CPT, ICD-10, PCS, CM codes, or whether you have calculated the DRG correctly based on the ICD-10, CM, and PCS codes or not. Okay, so we'll mock audit you, and we will publish the uh, final feedback to you. So based on the feedback, you can improve your IPDRG skills. And guidelines. Okay, so there will be something called coding clinic updates. So every 3 months or every quarter, okay, we will get a coding clinic update. So these are updates based on recent audits. So they will calculate, they will publish audit findings for recent audit, where we have they have changed any updates. So any sequencing rules they have changed, any procedure coding system they have changed. Okay, so payer rules, whether any payer rules are changed. So all these things we need to be having a updated knowledge. Okay, and so that will be given by the quarterly guidance, which is called the coding clinic update. So we will see a scenario, okay, and we will practically apply the DRG concept in this scenario. Okay, right. So here a patient is being admitted with pneumonia and is developing, or the pneumonia is the first attending or admitting diagnosis, and later the patient developed sepsis during the same stay, and now they are doing a bronchoscopy procedure also. Okay, so we need to code all this information using the coding system. We have the ICD-10 CM, ICD-10 PCS. So the ICD-10 CM code for unspecified pneumonia. So if they have not mentioned anything about the pneumonia, your code will be J18.9. So using the ICD-10 CM, we have assigned the diagnosis code. And sepsis. So the sepsis code for is A41.9. So this we will take from the ICD-10 CM, and we will assign this code A41.9. And we are going to have a 3-step approach towards finding these codes. Okay, I'll also let you know how to find these codes, yeah, like in a 3-step process, how we are going to find the code. And this is actually one of the guidelines that we have for reporting codes in ICD-10 CM. We will apply the same concept actually to the PCS also, and we will find the code for PCS also, the procedural coding system. Okay, so you have bronchoscopy here. So bronchoscopy, and so this is a via bronchoscopy they have studied, okay, what went wrong in the lung. So the bronchoscopy, examination of lung, is a diagnostic bronchoscopy, and it is done okay via the mouth. So this is done via natural opening endoscopically. So this is the ICD-10 PCS code for bronchoscopy. So each of the code will have specified information. For example, J18. Okay, so J12 to J18, the ICD-10 codes J12 to J18 are for pneumonia. For different types of pneumonia, you have J12, J13, etc. If the pneumonia is unspecified, our code will be J18.9. Similarly, for sepsis, you have ICD-10 categories A40 and A41. So if the sepsis is unspecified, we will end up in this code, A41.1. 0.9. So like ICD-10-CM, each character will specify some information. So similarly, right, ICD-10-PCS also, right, each character. So you'll have a 7-character code. Each character will specify one information. Okay. So the character 0 is for surgical procedures. So if a bronchoscopy is done, it comes under the surgical procedure. Okay. The second character is for the body system. The bronchoscopy is done for the respiratory system. The third character 9, okay, is done is for the right root operation. Okay, so the root operation here is the right endoscopic procedure to visualize the right lung. Okay, so that is an inspection, the root operation. Then you have, so we saw body system, second character. This is fourth character, body part. Which body part? So here they are mentioning, right, bronchus. Clearly, by bronchoscopy, it refers to the bronchus. Okay, and next, the fifth character is the approach. So we have a approach which is called natural opening, right, via natural opening, and endoscope is inserted to visualize the lung. Okay, so this is the right approach character. And sixth and seventh character will specify device. If any device is kept, we will assign that particular device code. Here you don't have any device, so the Z is used for no device, and X is for qualifying information. The qualifying information is here by diagnostic bronchoscopy. So the qualifying information we have reported X as the last character. So here you have each character specifying one information from the procedure. Okay, so here also we have right the category specifying right the particular system. For example, respiratory system, you have J. Okay, and yeah, if it is infectious, you have A and B category. So A comes under infectious diseases. So each character in the coding system will have an information, will carry some information. So that we need to determine and assign the code as appropriate. And finally, coming to the DRG. So right, DRG is the right payment classification system for the inpatient hospital stays. Okay, not only hospital, right? Any long-term care facilities, short-term care facilities, psychiatric units. Okay, so every such facilities are paid based on the DRG assignment. So the DRG carries the weightage for each of these right facilities. Okay, which shows the complexity, severity, right, and how the treatment protocol that was followed for to treat that particular condition. Whether it is like simple or whether it is requiring a higher rate of or care to the patient. So based on the care, we can simply say the complexity of the care, right, provided to the condition. So it may be also depending on the condition and the complication, the complexity of the care and severity, right, and how it directly impacts on hospital payment. So sometimes you'll have the procedure, right, impacting the DRG. So we will choose the procedural pathway. In some scenarios, you will have the diagnosis will having more weightage towards the DRG. So in that instance, we will go with the diagnostic pathway. So in this instance, okay, so you'll have a right diagnosis, okay, and a procedure. So right, so the diagnosis pathway is calculated for this because the procedure is a simple diagnostic procedure, right? If it is a surgical procedure or a more extensive procedure, the procedural pathway will affect the right DRG or hospital payment. So DRG assignment, right, impacts the hospital payment. So we need to right calculate the DRG based on the available information in the medical record. So here we have the diagnosis of right pneumonia and sepsis. So the right these two conditions have a more weightage than the diagnostic procedure. So the conditions will go and impact the DRG. So the DRG final payment will be calculated in this case with the diagnosis information. So when reporting the diagnosis and procedures, you need to follow some sequencing here also. So you have a lot of guidelines. Okay, you need to understand the guidelines. You need to right, make sure which pathway you can have to choose based on the guidelines, and which will have a weightage based, which one we can choose, whether it's the diagnostic pathway or the procedural pathway. Everything we need to calculate, right, in case of DRGs. So all these things, these techniques, okay, we will be actually, right, giving a comprehensive training in our, right, inpatient coding training. So understanding all these nuances of inpatient coding, not only the diagnosis selection procedure, but also the, right, guidelines, the compliance, and then the HIPAA security concerns. So the decision querying process. So everything we need to have a expertise for us to, right, be a inpatient coder. So that's about the inpatient coding systems and the inpatient, right, coding based on the DRG, how it is having an impact on it. So you have any questions? Anyone? Okay, so if you have any questions, you can chat, or you can talk here. What is the
Sir,
eligibility for this course? Farzana was asking.
sir, inpatient coding has a separate guidelines, sir.
Yeah, inpatient coding is entirely different from outpatient coding. So you have a different, right, guidelines also. The ICD-10 CM guidelines remains the same though, but the weightage, the DRG calculation. So it is having an impact based on the procedure or sometimes based on the diagnosis. So we have some guidelines in that particular part. Got this, Soumya?
Yes, sir.
Yeah. Anyone else having questions? Okay, so you don't have any life science experience. I have a CPC and a 3-year in HCC. So you're already qualified to be in the, right, medical coding industry, right? So you have HCC and CPC. So yes, uh, in order to have a good knowledge in IPDRG, I would recommend you to, right, undergo this training, and maybe you have to do a certification, right, the CCS certification. So if you are having hands-on experience, okay, so you might get a job in inpatient coding. So we will also give like a hands-on experience during our training. So it's also included as part of our training.
Hello, good evening, sir.
Yeah, Flossie. Good evening.
Yes, sir. I'm from nursing background.
Mhm.
And if I join the course and if I clear the exam, is there any opportunities work from home job, sir?
Flossie, that was a good question. Work from home opportunities will be there, provided your client, it's actually based on the requirements of the client and requirements of the company. Okay, and yeah, so sometimes what happens is, if you are an independent coder, okay, if you have a hands-on experience and you are saying that I can work independently without any errors, or you are exceeding the expectations of the company, okay, and maybe then they can give you work from home. It is all depending on the, right, the company, the process, the project that you are going to work in.
Okay, okay, sir.
Like for Fossey, like sometimes some professions will not suit from work from home. Okay, right. Some of the processes are like that only, so they will not. I mean, say that we can give work from home. Some companies they give, right, based on the requirements of the project. Okay, so it is all based on the project that you are going to work on and how much expertise that you have. So if you are experienced and having good expertise, you will be given work from home opportunities. For us, for me, I will say like at least if you have 1 year of experience and you are independently able to send the job without anyone's help, then you will be getting work from home opportunities.
Okay, sir. Thank you.
Yeah. Hello, sir. Good evening. Hello.
Yeah, this is Thomas.
Yeah, sir. Actually, I have done my CPC and CIC certification also, and I am BSc nurse. But due to my age category, now I am almost 33 years, and I have tried in so many companies, but they are not hiring due to my age and without any experience. They are not hiring. So now my certification also got expired. So what should I do now?
See, right, certification part, I would say no. Can I mute yourself? There is some background noise. Okay, the certification part, I say it is very, very crucial. Okay, to land in a job like after 30, okay, the certification is right, very, very crucial. So if you would have already had the CIC certification, okay, so now I can say that you will get definitely getting this job. Okay, so we have a client requirement. Okay, so if there are CIC certified coders, okay, they can be directly hired, and you have a nursing experience also. Okay, but I'm very sorry that you lost your right, credential or the CIC credential. But yeah, so try right, reinstating your credential, and maybe you can try for this right certification or recertification also. And so in this right CCS uh, training or IPDRG training, okay, so you can also get that certification from CCS. CIC is entirely different, right? That's provided by uh, AAPC. When it comes to CCS, it is entirely different. So you need a bit more training when it comes to CCS.
Okay, sir. Sir, if I do CCS, means is it sure that I'll be getting job instead apart from my age criteria also?
So that's the purpose of this training. Okay, age is not actually the criteria here. Okay, so CCS certification, and you have a good hands-on experience or knowledge, right? In IPDRG coding, right? So basically, you will get the job, right? Definitely, I can assure you that you will get the job once you get certified, and you're also already having nursing experience. So my recommendation, I think you can do this, and you'll be able to clear this also. Since you already have cleared the CIC, you can clear this also.
Okay, sir. Thank you.
We'll be we'll be contacting you, BT Thomas. We'll talk about it more. Okay, and maybe we'll get more clarification later.
Okay, sir. Thank you.
Anyone else is having any doubts?
Hi, Mohammed. I just have one query. So, I'm from a non-life science background. Will I be able to attend this course and get a job?
Can you tell me your name? I'm not able to see you on the screen.
Myself, Jeffy.
Okay. So even if you are a non-life science graduate, so what is like the right here the client requirement is like CCS certified, right? Then you will be getting a job. Jeffy, right?
Yeah, correct.
So yes, if you
So
are
age will not be a barrier over here, right?
yeah. So in this right, we are actually right having this campaign for the 30 to 40 only, and this is actually sometimes you can see that CCS certification only professionals will choose. okay, who are above 30. So they want to advance their career further. Okay, so they will only choose this CCS examination. So that is why we are focusing on that right age group. Yes, it is. Yeah, it is. You can do this and you can clear it. Right, you can definitely have a scope in IPDRG or inpatient coding.
Yes, sir. There are some questions in chat box. Please address that also.
Sure, Alex. So I'm looking at the questions. Yeah, course fees and all will be communicated by our sales team. I think they will get in touch with you. So I'm looking at the questions here.
Sir, in next slide there is contact details. Just display that also.
Sure, sure. So for more details, you can contact the right.
Hello, sir.
Yes.
Hi, this is Sharon.
Yes, Sharon.
Yeah, thank you for the session. Um, and just want to know some informations like I'm working as a coder, outpatient coder in UAE in a hospital. So I just want to get updated with my inpatient training also. So here we are using DRG. Not this PCS. So in this training, you will be providing DRG training because PCS we are not using here.
Yeah, I know that they are using only CPT. So instead of
C-
PCS, they are using CPT.
yeah, CPT like DRG using only. So what I'm
They are
asking,
using 3M only, right?
yeah,
You are using
through
3M.
integrated 3M only.
Okay, so the
So
integrated 3M will have PCS also. If you can scroll down any right where you have the CPT option or DRG option. Okay, so you'll have like multiple options there. If you scroll down, you can also see that the DRG can be calculated based on PCS. You might be aware of it, right?
yeah, PCS I have seen, but what I'm telling like PCS actually we are not using here. No, so you will be giving the training related to completely related to DRG through. So I just want to know like you will be giving the training through completely like DRG.
Okay, so like whatever we saw in the slide, it is actually focused on the training only. So we will give you training for right ICD-10 CM. Okay, so then second part. So when it comes to inpatient coding, you have three parts. Okay, one is the diagnosis coding. The second one is PCS, procedural coding, and the third one is calculating the DRG based on these three items.
Okay.
Okay, so
So you will be
definitely
giving.
we will cover diagnosis coding. The second part we will cover PCS. Additionally, we have some theoretical topics like compliance, HIPAA, etc. Right, and then DRG calculation.
So this
Everything.
DRG you will be giving through 3M or some other softwares. How it?
We actually give however you want. So we are looking for 3M means we can give it through 3M also. So right 3M restrictions are there. So we'll use
Yeah.
some right 3M version that is available for us, and we will teach you. So we'll walk you through how this right 3M and other softwares are navigated.
Okay, fine. So, so like you will be giving like a DRG only because we here like we are using decades DRG and all. But when it comes to like this inpatient for example, you told like for the length of stay, like more than a day, like that. So in that case, we just want to know how these DRG like which will be giving the more weightage and which we have to take as a primary, secondary, all these things. So through 3M, if it is we are getting training means that will be good for us because since we are working here.
Yeah, I understand it, but your concern is right, correct. But 3M is a tool, it is more advanced than the coders. Am I right?
Yeah.
If you just data, it will show you which is the primary diagnosis, which is the secondary diagnosis. It will show you like if you just drag and drop two diagnoses, which is having more weightage. So that is what we will learn. So which condition will have more weightage, right? And we'll tell you or walk you through that using 3M. So we will explain the concept and then we will put it in the 3M and show you like how it works.
Like that you will show us, right?
Yes,
So
definitely.
we will get a detailed knowledge about all DRG, right?
Yeah, sure.
Okay, fine. Okay, thank you so much. Thank you.
Thank you, Sharon.
Thank you.
Yeah, so some of the questions from chat box I'm reading. So yeah, someone has asked about Nasla is also having the same concern, I think. Nasla, that question answered your concern also, right? And Bitty's one we have answered, I believe.
Even mine also answered.
Yeah,
I
yes.
first
Okay.
yeah, so I got the information.
Okay. So is the medical coding certificate is required for inpatient coding course? I mean, if you are asking about the course for the course, you don't need any certification. Okay, so we will set you up for the examination, right? For the certification examination, so you don't need any prior certifications for this course. Rubna, is that question answered? Can a paramedical diploma holder can do this course? Yes, definitely you can do this course, okay, and have the benefit of an inpatient certification. Then you will be definitely landing in the job. Age limit, as I said, so we're looking for 30 to 40, right? So if you are between 21 to 40, then it is fine. So the age limit we set is like 21 to 40. Sadi, your question is answered. Okay, so non-life
What
science.
would be the average package once we land a job?
Okay, the average package, no, it based on the experience that you have previously drawn salary, etc. So if you have no experience, the package that they offer is like somewhere between 30 to 35 if you are a CCS certified coder.
Okay.
Rajlakshmi, you are from non-life science and also have a 3-year certification, HCC specialty. I think yours was answered. So you already have an experience, right? Yeah. So I would recommend, okay, so for inpatient, you do CCS examination. But if you want to go with the CPC and HCC experience, yes, you can go with that also to UAE. Nasla, I think yours was answered. Okay. Sherin and Nasla, your friends? Anyway, no, right?
Yeah, we are friends.
Huh. Okay, so you do have same questions as Ravi asked.
Yeah.
Roy, any exclusive job drive after this course? Yes, we have one client requirement. So after this course, you have a exclusive job drive also. Maybe that sales team and placement team will pitch you on that. Yeah, BT course fees and all. Okay, you can contact the details given, provided in that, you'll get it. Max age, I told you already. Okay, so if you are a beginner, okay, so 21. If you are already having a professional experience, okay, then 30. We see like 30 to 40 also for this course. Yeah, placement will be provided, right? Yeah, so every placement opportunity we will be discussing at the end of the session. Okay. Akshita also having a paramedical diploma, so that was also discussed. If you are already CPC certified, you can definitely do this course, Saranya. CPT is required. CPT is required for CCC examination. So CPT knowledge is also important. All the coding systems together. BT.
So how much would this certifications be costing us?
Come again, Jesse?
How much
What
amount
is the
would
cost
these
for certification?
certifications be costing?
So
Yeah.
CCS will be like it is varying based on the US dollar. Okay, so it is like close to 40,000. Okay, so it will be based on the US dollar, and then you have something called membership. So you'll have a 2-year membership plus one attempt. So that also the sales team will pitch on that also. So please contact the sales team so you'll get the more details about the cost and everything. Okay. Yeah, so if you're not science, Nihara, okay, medical coding background, you don't have 41. Yeah, we'll get back to you, Nihara. We'll discuss it on that. Okay. Your team, please note Nihara's question so I can answer that better. Amisha M. Yeah, comparing to HCC, which specialization have more opportunities? That depends on the market, so now we see that Cigma as the academy, we see that we have more opening towards CCS. So that is the main reason, right? We are conducting this webinar so that people are aware about this certification and the opportunities that we have in inpatient code. So basically, that depends on the market. Padma, medical billing for 7 years. Okay, right, 47. Okay, so definitely we will get back to you, Padma, right, on this. Okay. Soumya CPCA. Okay, CCS is required for me. I'm a Sigma student. So inpatient coding is entirely different from outpatient coding. So CPC is a professional fee component, only outpatient coding. Okay, you'll have that experience. So you'll not have hands-on experience on PCS coding at all in CPC. So you'll definitely require CCS for inpatient coding. But there are some companies, they hire the CPC certified, but the project that we are looking for requires CCS examination. So it is again entirely based on the industry. Okay, pass percentage, that's a good question. So we have an entirely different format for this CCS examination. You will have the questions calculated based on some weightage for each of the question. Like you'll have 97 direct questions and 8 case studies. Okay, so based on this, the 97 questions have different weightage, and then case studies will have different weightages. Total weightage or total marks will be 400, and the pass is 300. So it is 75%. Non-science background, I think we have already addressed this. Completed CPC training. Okay, so I would recommend if you've already taken the CPC training, okay, you can go for CPC certification. Or if you wish to pursue a more comprehensive certification, you can go for CCS. Shamir, you can join this course without any prior knowledge. So that is also answered already. Sasni, yeah, you are also non-science graduate, so that is also answered already. Yes, if you are a non-science graduate also, right, it's okay that you learn this course and get certified. Will be right. Yeah, Cigma has placed many non-science life sciences graduate in medical coding industry already. We have a proven record of that. So yes, okay, you can have this training, get certified. You will be entering into the medical coding industry. So all your questions have been answered. Alexa, we have anyone else to speak to end the session?
One point just I wanted to say, I have shared one attendance form. Everyone please fill that form, and we will collect your phone number, and our admission team will contact everyone. And also you can call, you can utilize this number, and you can ask, yeah, you can raise your queries with directly with our admission team. That's it from my side, sir.
Okay, sir. Thank you. So, guys, so I'll also like to write. Okay, so can you guys see the screen? So these are the key takeaways from today's session. Okay, so what is inpatient coding? So what is what we learned, the coding skills, okay, that you need to acquire for this inpatient coding, that is ICD-10-CM, ICD-10-PCS, and DRG role on, right, calculating the hospital payment. So that's right, three thing when it comes to inpatient coding. It is a right a complex right coding, or I'll say, but it is highly rewarding when it comes to right IPDRG or no CCS certified coders. So you'll have a higher payment when it comes to uh, right, inpatient code. And yeah, you have a high demand for CCS inpatient coders, right? So if you consider the number of CPC certified coders and CCS coders, so you can say like there are like 60. When you require 100 right CPC coders, there are already 60 right CPC coders. When you require 100 CCS coder, okay, we'll have only 30 CCS coders. So there is a huge gap in case of CCS. So CCS, right, you have already 70% gap in the industry. So there is high demand. So yeah, so there is already a right gap in the industry. So to fill that gap, so you're already having high demand for that. With the right training and certification, and I would also say with the right academy, so you'll be having a right good prospectus or in this inpatient coding career. If you are having the right skills, you are the right person to be hired. Am I right?
So just one query over here. So the clients would be majorly US, UK, and also would we be working like in IT companies or something like that for these clients?
Okay, so these are right healthcare companies. All these companies are okay par equal to IT companies, I would say. Okay, so we have many companies. We directly they are US companies like Optum. We have many projects directly taken from right US hospitals, like if you say any company like Omega. Okay, so you can see directly they have the US projects. Okay, so all this put together, like it is more or comparatively par equal to the IT job. Got it?
Hello, sir.
Yes.
I have one doubt.
Yeah, please.
Without CPC certification, I get a job with inpatient coding.
Okay. You're saying that without CPC certification, you can attend this training, right?
Yeah.
Okay, so CPC certification or previous experience in medical coding is not required. So, right, we will give the comprehensive training. So after the training, you may right undergo the certification, CCS certification, and right, you will have a higher chance of landing into a inpatient coding. The certification opens the career. Okay.
Okay.
So if you don't have any other questions, right, I would like to end this session now, right? And I look forward to see you in the training. Thank you so much, everyone. Thanks for joining.
Uh,
And yeah,
everyone, please fill the attendance the form that I have shared in the chat box. And let's wind up the session. Thank you so much. Thank you, Riaz sir. Thank you so much, everyone.
thank you, Alexa, for coordination, and thank
Thank
you,
you.
everyone. I appreciate your patience. Thank
Aija.
you for your interest.
Thank you, sir.
Have a great evening and weekend. Bye bye. See you in training. Bye bye.